Hey everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today in episode 70, I want to discuss whether TSH levels really matter, especially if you have hypothyroid symptoms or a hypothyroid condition. Recently, a great paper written by some of my favorite authors, Huerman, Dietrich, Midgley. These guys came out with a paper called Recent Advances in Thyroid Hormone Regulation Toward a New Paradigm for Optimal Diagnosis and Treatment. This is from Frontiers in Endocrinology in 2017, December. Key points in this paper that they talk about is that TSH by itself is not a valid marker of thyroid physiology. Now, I've talked about that multiple times. There's many things that can influence TSH levels, and TSH is really only a valid marker of thyroid physiology in the body when the body is in a homeostatic or balanced and healthy state. And for most people who are struggling with hypothyroid symptoms, they're not in a homeostatic state. They're in a stressed, or what we call an allostatic state, okay? The second major point that they talk about is there are many factors that can influence TSH, causing it to be inappropriately normal or appropriately high or low without thyroid gland disease. So let me break that down a little bit. You can have inappropriately normal TSH levels. So if you're tired, if you're fatigued, if you have dry skin, if you have weight issues, you have constipation, you have brain fog, fatigue, all these common symptoms of hypothyroidism, and your TSH is normal, there's something wrong, okay? TSH may no longer be a valid marker of your thyroid physiology. It may be normal, but inappropriate. Look, if you're increasing body weight, if you're storing body fat, one of the things your body's going to do is increase thyroid hormone production to try and get you more active, to kind of drive you to do more things, or to increase heat, to get rid of or dissipate this extra energy that your body's accumulating, okay? Normal physiology would work to burn off that excessive load of calories, okay? That's how it's supposed to work. So if you are a person who has hypothyroid symptoms and your TSH level is normal, that's probably inappropriate, okay? It may be artificially suppressed. Things like chronic inflammation can suppress the pituitary gland to not make as much TSH. So when doctors just look at TSH and say everything's good while you're sitting there overweight, tired, fatigued, constipated, dry skin, thinning hair, it's an inappropriate normal, okay? So you can have appropriately elevated or low values without thyroid hormone disease. So typically if your doctor sees your TSH elevated or TSH below range, they would assume that there's something wrong with the gland. But really, the gland can be working fine. If the TSH is low, the body may have sufficient levels of thyroid hormone currently, and there isn't a need to generate more thyroid hormone, so TSH will be lowered. There are certain stress conditions where the appropriate thing for the body to do is lower thyroid hormone production and lower TSH. If TSH is elevated, that may be out of lab range, but totally appropriate for what's going on in your situation. If you're starting to add weight on, if you're taking in more calories than your body needs, the body may increase TSH to increase thyroid hormone production, to increase metabolism, to get rid of that extra calorie load, okay? So sometimes the levels are elevated out of lab range, but are appropriate for what's going on in your situation. And sometimes TSH levels are low, below lab range, but again, appropriate for the situation or the stress that your body's under. Third point is that they stated that physicians must be more thorough in assessing thyroid physiology. And I talk about that quite a bit. I don't think we can look at people today with just a TSH level and a T4 and determine whether they have a thyroid physiology condition. We need to be running full thyroid panels. TSH, total T4, total T3, free T4, free T3, reverse T3, T3 uptake, and thyroid antibodies. And I think we have to take it one step further than that. We really need to run complex metabolic panels that have inflammatory markers on them as well. We need to look at blood sugar physiology. We need to look at uric acid levels. We need to look at fibrinogen, homocysteine, CRP. We need to look at the cholesterol panels to see if cholesterol is rising. If cholesterol is rising, that's a classic sign of cellular hypothyroidism, okay? And too many doctors see an elevated cholesterol and don't even tie it back to the fact that there's cellular hypothyroidism going on. They just put them on a statin, which doesn't help the person at all, okay? So what they said is only running a TSH and trying to normalize TSH with thyroid meds many times does not normalize thyroid physiology. And that may be the case for you. You may have gone into your doctor, you may have actually been lab elevated on TSH and lab low on T4 and diagnosed as primary hypothyroidism, and then put on thyroid hormone medication and your TSH normalized, but your symptoms didn't normalize. You still have those hypothyroid symptoms and your doctor is blaming you, saying you're tired, you don't eat, you're eating too much, you don't exercise enough, you're just stressed out because you're a mom, you need to rest more, you need to meditate, you need to take anti-anxiety medications, and those are really all just excuses. What we're finding in the research, for those who really do have overt primary hypothyroidism, okay, that what they found is you can't use normal TSH ranges anymore for these patients. Matter of fact, they often have to have their TSH levels into the lab low range to even start to help improve their symptomatology. One of the really key things about TSH, and that's really important, especially when it comes to supporting somebody with thyroid hormone, is that it doesn't matter as much what the TSH is, what blood values of T4 and T3 are. It really matters how much of that thyroid hormone is getting into the peripheral cells and being converted from T4 to T3. So what's important along that point is that the cells determine what happens with your thyroid hormone. The cells either activate thyroid hormone and help it bind to the receptors to stimulate metabolism, or the cells deactivate thyroid hormone and shuttle it out of the cells and out of the body. It's the cells that determine that. And you can have totally normal TSH, you could have totally normal T4 and T3, but still have hypothyroid symptoms because your cells are under stress and they are deactivating your thyroid hormone. I'm going to do a case study on Thyroid Thursday, episode 71, where I kind of explain how a woman who came to me with chronic hypothyroid symptoms, who was told she has normal thyroid physiology, when we looked at what her doctor ran in TSH and T4, it looked like she had normal physiology. But when we ran a more complex thyroid panel like this, we could see that her cells were deactivating her thyroid hormone. And then when we looked at the full comprehensive metabolic panel, we could see multiple markers of inflammation that would be a major factor for why the cells were deactivating her thyroid hormone. So, great paper. Does TSH matter? It really doesn't matter that much if you have been diagnosed with hypothyroidism or you're still struggling with hypothyroid symptoms. The issue is TSH can be normal, but inappropriately normal, and it can be high or low, and you can still have hypothyroid symptoms. So TSH, once you're struggling, once you're out of this kind of normal, feeling well, balanced, homeostatic state, once you're out of that state, you got stress, you got inflammation, you have poor sleep quality, you're showing signs and symptoms of hypothyroidism, TSH by itself is no longer a valid marker of thyroid physiology in the body, and the research is showing that over and over and over again, okay? If you have any questions regarding this video or any video, put it wherever you watch the video, and you can always call my office if you need some help or guidance, okay? Take care.